everyone. My name is Dr. David Kowalczyk. I work with Colorado Facial Plastic Surgery. We've designed a series of educational lecture videos which are short and hopefully provide some information about some of the common procedures that we do. We feel it's really important that patients understand the anatomy and some basic concepts behind the procedures to be an informed consumer. If you have any questions, concerns, or comments, feel free to leave them at the bottom of the video on our YouTube link. We would really appreciate it. Thank you. Hello everyone. Today we're going to talk about forehead and brow lift. Hopefully you'll learn some more about these common procedures which we do at Colorado Facial Plastic Surgery. So before we go into some of the more detailed anatomy, it's good to take a look at forehead shapes in the profile and the full face. Some people have a straight forehead, others are sloped, some are convex or jut outward, and some are wavy or go inward. And when we look at the full face view, it's important to note where the eyebrow is and where the hairline begins and how far over it goes. The amount of forehead that's available will determine how much pull needs to be done and potentially how much skin needs to be removed. Furthermore, it also changes the approach. Someone who has a straight forehead may be able to get away with a different procedure compared with somebody who has a very, very sloped forehead where instruments can't reach certain areas. So as we go beneath the skin, you can see some of the important muscles that control the brow and forehead. The depressor, the procerus, and the corrugator help to create a frowning movement like this. Raising the brow is accomplished by the frontalis muscle. The frontalis muscle and some of the surrounding eye muscles need to be freed to allow repositioning of the brow during the procedure. So this is a brief diagram and picture that shows the aesthetic ideal of how the eyebrow should look relative to the eye. If you draw a straight vertical line from the medial or the middle part of the eyebrow down along the lateral part of the nostril, and a line that goes tangent from the nostril toward the lateral canthus. That's about the eye position and about how wide the eyebrow should be. The peak in a female should be right at the lateral limbus, or the colored part of the eye should be the highest point. The overall brow should sit about a few millimeters or more above the superior orbital rim, or the bony part of the eye. You can see in this picture with the diagram, the brow peak in a female is actually moving further to the side. And we've seen that trend in beauty magazines and with models that the peak is actually moving a little bit more laterally or to the side. A male brow differs in the sense that it's flatter. There shouldn't be a very high peak, and it should sit closer to the superior orbital rim. So now, what are the various approaches to do a brow lift? Well, this demonstrates the most common ones, and there's a number of different incisions that can be made, and the physician will go over what the best approach for you is. We have a direct brow lift, which goes right near the eyebrow. We have a mid-forehead, which is typically good for older gentlemen who have deep wrinkles, that you can recreate a wrinkle or a crease in the forehead. We have a temporal lift, or near this aspect, which can help pull up the side of the brow. We have the endoscopic, which involves cuts up in the hairline and instruments that go down to allow freeing of these muscles and repositioning of the brow. We have what's referred to as a trichophytic or a pretrichal, which means at or with or before the hairline, which would involve removing typically some skin to shorten the forehead. And then we have a coronal approach, which involves a very large incision that goes almost from ear to ear for large exposure and significant movement of the forehead and scalp. And this is a quick illustration of the endoscopic approach, which is one that we commonly employ here, and it involves incisions within the hairline and instruments that are used to free up some of the muscles and attachments to move the forehead and brow in a better position. Well, I thank you for your attention. Hopefully you learned something about forehead and brow lifting. If you have any questions, comments, or concerns, please leave them on the comment section.